You gave your baby approximately 30 grams of calcium to build its skeleton. Most of it came from your bones. Your body is designed to take that calcium back. The research is clear on this. In most women, it does. But the word most is doing a lot of work in that sentence. For a significant number of women, recovery is incomplete. The shortfall doesn't show up in your 30s. It shows up in your 50s, at your first bone density scan, when the damage is already done and the window to act easily has closed. This video is about what actually happens to your bones during pregnancy and breastfeeding, the mechanism your doctor probably never explained, and the 3 nutrients that determine whether you get your skeleton back. Let's start with the biology, because it's actually remarkable. During the 3rd trimester, your fetus needs to mineralize its skeleton rapidly. That takes calcium, about 250 to 300 milligrams per day at peak demand. When dietary intake isn't enough to meet that demand, and for many women, it isn't, your body triggers a hormone called parathyroid hormone-related protein. It's produced by the placenta itself. Parathyroid hormone-related protein tells your bones to release calcium into your bloodstream, so it can cross the placenta to your baby. This isn't a flaw in the system. It's the system working exactly as designed. Your body prioritizes the fetus, every time. After birth, the demand doesn't stop. Breastfeeding women lose a further 3 to 10% of bone mineral density over the first 6 months of lactation. Studies on lumbar spine bone mineral density confirm this is measurable and significant. 6 months after weaning, most women's bone density has returned to baseline. That's the good news. The important word is most. And baseline assumes your baseline was adequate to begin with. Here's where the research gets specific, and where most women are let down. Bone recovery after pregnancy isn't just about calcium intake. Calcium without the right cofactors is largely wasted. There are 3 nutrients that determine whether the system works. The first is vitamin D. Vitamin D controls calcium absorption in the gut. Without sufficient vitamin D, specifically 25-hydroxyvitamin D above 50 nanomoles per liter, much of the calcium you consume passes straight through your digestive system without being absorbed. The Lasky and Prentice data is instructive here. Vitamin D status at baseline was the single strongest predictor of how completely a woman's bone density recovered post-lactation. The problem? Vitamin D deficiency is extraordinarily common. In Singapore and much of Southeast Asia, despite abundant sunlight, indoor lifestyles mean a significant proportion of women are deficient. In the UK, deficiency rates in women of childbearing age exceed 40% in winter months. Second is vitamin K2. Vitamin K2 activates a protein called osteocalcin. Osteocalcin's job is to direct calcium into bone tissue, rather than allowing it to deposit in soft tissue like arterial walls. Without K2, you can have sufficient calcium and sufficient vitamin D and still have poor bone mineralization because the calcium has nowhere to go. K2 is found in fermented foods, natto, aged hard cheeses, some fermented vegetables. It's one of the most underconsumed fat-soluble vitamins in Western diets. The third is magnesium. Magnesium sits upstream of both of the above. It's required for the enzymatic conversion that activates vitamin D in the kidneys. Without adequate magnesium, vitamin D supplementation is significantly less effective. Magnesium is depleted rapidly during pregnancy. The fetus draws on it heavily for neurological development. Most prenatal vitamins contain suboptimal forms and doses. Now, it's worth being honest about what the research also shows on the other side. A longitudinal study by Olason and colleagues followed women for 7 years after pregnancy. In women with adequate calcium intake, there was no measurable long-term bone density deficit. Their bones recovered fully. This is important. Your body is genuinely designed for this. The mechanism is robust. The challenge is the word adequate. Most women don't know whether their calcium intake is adequate. Most have never had their vitamin D tested. Most have never thought about K2 at all. The system works when the inputs are there. The question is whether yours are. So what does this mean practically? 3 things worth knowing. First, find out where you actually stand. Ask your doctor for a 25-OH vitamin D blood test. Most people assume they're fine. Most people aren't. Second, look at what's in your supplement. Most prenatal vitamins use the cheapest, worst absorbed forms. Look for D3, magnesium glycinate, and K2. If they're not on the label, they're probably not in the bottle. Third, lift something heavy regularly. Bone responds to load. Resistance training is the most evidence-backed thing you can do for bone density. It compounds over decades. Start now. None of this is alarmist. Your body did something extraordinary. The biology is designed to recover. The point of this video isn't to frighten you. It's to give you information that the standard postpartum checkup doesn't. The decisions you make now compound over decades. Bone density lost in your 30s and not recovered shows up as fracture risk in your 60s. Perimenopause, when it comes, removes another layer of estrogen-driven bone protection. The women who arrive at 60 with strong bones didn't get lucky. They understood the mechanism early enough to act on it. If this was useful, the next video in this series covers exactly what happens to your bones at perimenopause and the window most women don't know they have.